Dental implant is a surgical grade titanium fixture, we call it, that goes into the mouth, into the jawbone, where the original root of the tooth was located. And then after the implant heals, we can put a tooth on it, so now people can get their teeth back without having them to be removable. The most common reason that people need dental implants is if you start missing teeth and you don't replace them, it compromises how you chew. And if it compromises how you chew, you alter your diet of what you can eat. And so you stop chewing good crunchy vegetables and things like that. You go to a softer diet. Well, that can overall affect your health. So having teeth that you can chew properly not only looks better, feels better, but it can prolong your life to have a healthy nutrition. We take a three-dimensional x-ray because I want to be able to see three-dimensionally the shape of the bone where the missing tooth is located. With that information, I can decide what position to place the implant, what size to place the implant, and really focus on what's the best implant for that particular situation. So we make a device that fits over the other remaining teeth that tells us exactly where to place the implant. And to make that guide, we use x-rays and we use three-dimensional imaging, and we marry the two together, so we place the implant in a virtual world before we place it on the patient. I don't think I've ever written a prescription for narcotic pain medication after placing an implant. Patients usually say they took one Tylenol that night, maybe one the next morning, and that's it. Yeah, the recovery's actually very quick. I mean, you kind of got to be careful with it for the first few weeks because it is something in the mouth that has to heal. And we let it heal for like 4 months so the bone actually grows to it and fuses to it, so it's extremely strong. And then after that 4-month period, we place parts that go like inside the implant that stick up into the mouth, and that's what we put the crown on. That's called an abutment. But those secondary phases, we don't even have to numb the patient up to do it. So it's a lot easier than you might think. In general, most healthy patients that haven't been missing teeth for a terribly long amount of time, they're a candidate for placing a dental implant.